But with this journey, of which I'm towards the end of the level 1 part, I'm able to identify how I haven't been aligned in myself and supported within myself, and how has actually that affected my 3D actual physical life. And it's been an amazing journey of actually releasing in my body pockets of tension, pockets of like emotional. So last session with Victoria last week, I was asking her movement of the shoulders, like what, I could do the movement and what was the purpose of it. And it's funny because later in the day, I had bits left and right of my spine, like really pain releasing. I was crying, I was feeling exhausted, and I couldn't believe how tension is held in the body, and through certain aligned movement and different way of moving, that those trapped bits are finally able to get released. So for me, it's been beyond what I was hoping for. So yeah.
Great, thank you. Okay, Rose, would you just like to share just how your body's feeling right now? What's going on?
Hello, everyone. Yeah, how my body's feeling right. My lower back is very sore right now. So I have got arthritis, 4 vertebrae in the lower back. So that's caused a lot of discomfort with me, and there are others, but I'll just share this one.
Thank you and welcome. And we are going to focus on the kind of connection to the lower back today. So just take it very, very easy. Don't do any big movements, but just begin. We'll be bringing attention and connection to that area. Melanie, what's your
Hello. Yeah, I've had a few sort of lung issues recently, so on and off sort of pain is sort of in the lungs, rib cage, sort of especially on breathing and expansion.
Okay.
Yeah, that's
okay. I'm smiling because when we do in the Get Into Your Body methodology, week 5 is called rib cage release. Oh my goodness, people, it's one of the weeks that people love the most, because it's like, how did I never know that? It's that kind of process, a bit like what Diana just said for the scapulars. It's that, and the impact that has on your lungs and your breathing is it's life-changing. I have a video testimonial of someone talking about that. Actually, I'll try and forward it to you. Hilly, would you like to share why you're here?
Is it me?
Yes.
Okay.
Yeah. Just
well,
quickly
I'm here because I met you yesterday in Denmark, a little outside Copenhagen, and when we had this, when we talked about our issues, I had something with my feet, and you told me, yeah, I understand why you have something wrong with my feet. And you were looking at it and say, oh, you have to do something about that. And since then, I've been walking like a duck. What do you call it? Duck. I feel like I'm walking like a duck. And you invited me to come here and see what it is. And I have also a lot of pain in my lower back and the sacrum.
Yeah,
so you
absolutely.
And when I have these issues.
Yeah.
Yes.
And you can't not have that pain in your back when you're walking the way you've been walking. So it's just the two go together. Joe, very quickly, do you want to just say why you're here?
From one duck walker to another, that's probably how I walk, but for different reasons. So you're not alone. So I've got a lot of discomfort in my knees, and actually this morning my lower back and my pelvis partly were brought on, I think, by excessive gardening yesterday. But when I say excessive, actually it wasn't excessive. I'm all out of balance today because I think I was kneeling Anyway, it's just worse than it should be. So it's discomfort in knees and pelvis, and yeah, just feeling generally that makes my walking and my stance very heavy.
Yeah. And Jo, we just started you on week 1 of the Get Into Your Body process. So you've started to understand more about your feet, haven't you? So we're in the process,
yes,
but we haven't really got to the back and the psoas yet. Today is going to be good for you. Malasula, quickly, would you like to share something?
Just a little bit of a flare up with my foot, but not as much as it was before. And yeah, just generally feeling much better in my body, because I had a lot of back pain and inflammation around the pelvis and whatnot. So that's all disappeared. It's now my foot that was operated on.
Okay.
Working on that now, so I'm hopeful that it'll, yeah,
Okay.
minor compared to what it was now. Yeah, thank you.
All right. Well, we welcome all of those little messages of discomfort in our body this morning. And let me just show you, I've got my teaching assistant for Get Into Your Body made me get these. So can you all see?
Wow.
Welcome. Can you all see this? This is what you have inside you. Just a minute, let me put the light on. Is that better? Can you see this?
Yeah.
Yeah, so
Straighten it up a little, darling, because you're a little wonky.
oh, thank you. Okay, yeah, this will do from the front. So inside you all, oh yes, goodness, what a hike I've got. Can you see how easily we can hike incorrectly? And this is what happens in your body, everybody. Yeah, you only need something to be a little bit out. And can you see the difference it makes? And you're walking around with all of this going on inside your body, under your skin. So what we're going to do this morning is we're going to get you into your bones. Yeah, we're actually going to get you to try and feel into this area, starting with your feet. And I don't know what the back's looking, but we're going to try and get you in feeling into this area in your sacrum as well. So this is your sacrum, where the spine is attaching into your pelvis. Okay, this is your pelvis. All this bowl here is your pelvis, and these are your hips. Okay, so your hip joints, when I say hip joints, and I'm going to ask you to rock your pelvis. Okay, this is what I want you to imagine is inside you, but I don't want you just seeing the picture. I'm hoping that you're going to be able to feel it. Okay, so if you're able to, I would like to invite you to stand up. And if you can stand with your feet, let me just show you. Yes, so stand with your feet apart. So not like this, not with your feet turning out, and not with your feet too close together. But I want your second toes, if possible, to face 12 o'clock. So if you imagine you're in a clock face and 12 o'clock is in front of you, 3 o'clock is to the right side of you, and 9 o'clock is to the left side of you. And I would like your second toes to face 12 o'clock, hip width apart, so not like this and not like that, but so that your heels are directly under your hip joints going into your pelvis. Okay? And then what I'm going to ask you to do is think of your feet. So here we have a foot, and inside your foot you have 26 bones and 33 joints. And the capacity for support from this mechanism is profound, but the capacity for instability, if this is not aligned correctly, is equally profound in terms of how it creates pain or even dis-ease in your body. So if you look at this foot, I want you, while you're standing there, to think of 3 points. One is in your heel, okay? And one is at the end of this but long bone, just before your big toe. And we call this your first metatarsal, okay? And then this point, your 5th metatarsal. So we have a kind of triangle. We call it the foot tripod, going from the heel to the outside of the foot just before your little toe, to the inside of your foot just before your big toe. And then your second toe, I want facing 12 o'clock, so long as it's not uncomfortable. If it's uncomfortable and you need to turn your foot out slightly, then do so. I don't want anyone creating pain, all right? But this is what you're standing on. This is your support. Without this working in a balanced way, nothing further up your body is going to align correctly. So now I want you to think first into your right foot. And I just want you for a moment to think about the fact that you have 26 bones in your right foot. It's a lot of bones. 33 joints, 26 bones. And I'd like to invite you to think about those 3 points I just showed you. The first metatarsal just behind the big toe. The 5th metatarsal just behind the little toe. And the heel. And I'd like you to feel where you feel the pressure, the weight of your body sinking into your right foot. Do you feel it more at the front of your foot? The back of your foot? The inside of your foot? The outside of your foot? If you think about the weight going down your first metatarsal, the point on the inside by the big toe, and the 5th metatarsal by the little toe, does the weight, the pressure feel equal between the two, or does it feel different? And for today, all we are doing is observing. This is a check-in. We are not trying to change things, but we need to observe what's happening in our body before anything can transform. And if you were to allow your weight, your whole body just to fall slightly forwards, can you notice how it changes the pressure in your right foot? Or if you would allow the weight of your body to go slightly backwards, can you feel how the weight goes very quickly into your heels? And then just bringing yourself back to center. And now I'd like you to bring your attention to your left foot. Same process, 26 bones, 33 joints. This is the only part of your body that connects with the ground. It holds you up. And if it's not working well for you, the rest of your body will react to that. So 26 bones in that left foot, just having a sense of allowing them to spread, to settle. Feeling the pressure going into the first metatarsal behind your big toe. The 5th metatarsal behind your little toe and your heel. And noticing, do you have more pressure in the front of the foot, the back of the foot, the inside of your foot, or the outside of your foot? And now if you were to feel into your left and right foot at the same time, do they feel the same? Are they both having the same experience and relationship with the ground, or is it different? And there's no wrong or right here. There is simply observing what your body is experiencing. It's all incredible information. And now I'd like you to bring your focus back to your right leg and to the lower leg. So coming up from your heel in front of your ankle, you have the 2 lower leg bones. your tibia and fibia. They start in your ankle and heel and they come up into your knee. That's the tibia and fibia. And if you were just to bend your right knee very slightly, just allow it to bend, and you'll feel the tibia and fibia just falling down towards the foot, sinking down because you bend the knee, because the upper heads of your tibia and fibia create part of your knee. And if you then straighten your knee, you feel those bones coming up and bringing the knee, allow your knee to be engaged and straight. Then allow it to bend again and just feel those lower leg bones sinking down towards the ground, connecting into your ankle, but also as you straighten your knee, feeling the power as those bones move upwards, engaging the knee, which means locking the knee straight. And doing that a couple more times, just becoming aware of those right lower leg bones. It's bending and straightening the knee, which is really just the heads of bones joining each other. And now let's do that in your left leg. So again, you have the tibia and fibia leg bones connecting into your ankle, into your heel. And they come up into your knee. And just bending the left knee slightly. Can you feel the sense of those bones just sinking down slightly towards your feet, your left foot, and then as you straighten your knee, you can feel the bones moving upwards to straighten your knee. And just again doing that a couple of times and just beginning to feel into the mechanics of the way these bones are driving your body, allowing your body to stand straight or fold downwards. And then I'd like you to come back to your right leg, and this time to your thigh, and just to become aware that you have a thigh bone in your upper leg. It's called your femur. And again, the bottom head of the thigh bone is actually connecting into your knee. So if you bend your knee, that is the thigh bone dropping downwards. And as it drops downwards, the upper joint, which we've looked at, which is the hip joint, will pull your pelvis down slightly as well. So we looked at the picture on leggings. So now that thigh bone, as the knee bends, thigh bone drops, and the upper head connected into your pelvis as your knee bends, just pulls the pelvis downwards. Now, if you have any discomfort, do not move into discomfort. You can do teeny weeny movements. So just straightening the knee, the right knee, and very gently bending it a teeny weeny bit. And you feel how that creates kind of pulling down in your pelvis. Just pulling down that pelvic bone and straightening the right knee. And then let's visit your left femur, your left thigh bone again, just bending the left knee slightly, and the head of the femur bone and the knee meets the two lower leg bones. And that is what your knee is, with another little bone called the patella and muscles. And just feeling that left femur dropping slightly, pulling your pelvis down on the left-hand side when you bend the knee. And then as you straighten the knee, can you feel the left femur almost pushing up your pelvis, pushing up the left side of your pelvis as you straighten that left knee. Just do that a couple of times in your own time. And now what I'd like to encourage you to do is just putting your hands very gently on the front of your pelvis where your thighs meet your pelvis, so around your groins. And just have a sense that both your left and right femurs are coming up into your pelvis, and maybe just give your pelvic bone a bit of a prod. Yeah, you know there's a pelvic bone in there underneath all that flesh, muscles, connective tissue. There is a big bone in there. And I'd like you to invite that big bone just to rock very, very gently backwards and forwards, very gently on the heads of those femur bones, those thigh bones which are coming up. Just allowing the pelvis. So you have your spine at the back of your pelvis. You have an area which we looked at on my leggings, where the spine comes in and connects into the middle of the back of the pelvis. It's called your sacrum. And this area of your body, these bones have the capacity to just rock under. So your tailbone, your coccyx kind of tucks under. And when you tuck it under, you might feel your bottom kind of tighten slightly, which is great. It's all good. And if you were to send your tailbone backwards behind you, so you start to feel more of an arch in your back, you'll feel your bottom muscles relax. So all I want you to do is just rock your pelvis, see if you can tuck it under so you feel your buttock muscles just engage and support you. And just moving between the two. So you actually have a right side and left side of your pelvis, which can move opposite, but for today we want them to rock together. And just enjoying rocking the pelvis, just backwards and forwards on those hip joints. And take a few breaths and just notice if your jaw at this moment is very tight. Maybe relax your jaw, relax your mouth, take a few breaths and feel your breath coming down into your pelvis. So your pelvis is a bowl. It's holding organs, your bladder, your sexual organs, digestive system, everything, so much going on that is held in this extraordinary pelvic. So just thinking about those amazing parts of your body as you're wrapping that bowl backwards and forwards, tucking the tailbone. And now I want to invite you to think of your spine. So your spine is beginning in the base of the back of your pelvis. And just rocking those tiny joints, just rocking the pelvic bone backwards and forwards, just having a sense that this is the base of your spine. And then I'd like you to relax your belly, just take a few breaths. You could even bring your hand onto your belly. Taking a few breaths, understanding that you've got all your digestive system in here, you've got muscles, your kidneys at the back, enjoying that rocking. And slowly I want to invite you to move up the different vertebrae in your spine. So we have the vertebrae in your sacrum, which are all attached to your pelvis. And then we move up through your lumbar vertebrae. So in your lower back where your belly is, just 1, 2, 3, just having a sense that you have different vertebrae in here. Just maybe doing a little rock. One vertebrae, another one, coming up through the lumbars in the back of your belly. And you might not be able to have any sense of your spine. You may be having the experience of, I can't feel a thing. I don't know what she's talking about. This is all so strange, and that is okay. Just be with that experience, because this is a very new process for many people. But just continuing just to rock your pelvis very slightly and your lower back with the knowledge that even if you can't feel it, you know that one by one you have these little vertebrae, these little bones coming up through your spine. And what is that like? And knowing that they're there but not being able to feel them, one by one moving up. And then you're going to arrive at your thoracic vertebrae, which are the vertebrae in your rib cage. 12 of these, and they start at the base of your rib cage. So just one by one coming up through these thoracic vertebrae in your rib cage. You have the sacral vertebrae, you then have the lumbar vertebrae, and then we come into the thoracics. And in between all of the different vertebrae and ribs, you have little muscles. And there is so much going on in here. And then you could just pop your hands on your chest and just take a breath into your rib cage. And just with a knowing that you know those vertebrae are there, that every rib is connected to a vertebrae in your spine. And just very, very gently breathing into the area, knowing that inside your extraordinary rib cage attached to your upper spine, you have your heart, lungs, your liver, digestive tract, and other organs, many muscles and connective tissue. And your spine is just there, it's just coming up from your pelvis, just supported by your femurs and your lower leg bones, and you're there, you're standing, and your body is a miracle. It's the most extraordinary sculpture of movement. And then bringing your attention back to the rib cage, back to the thoracic vertebrae, which are being connected to your ribs. And then we're going to keep traveling. We're going to come up into your neck area, the cervical vertebrae. We have 7 of these. And maybe just give each one of those 7 vertebrae a little breath, a little acknowledgement. And again, if you can't feel them, that's okay. Just know they're there. Breathing into each one of them. And then they come up and the top one connects to your skull. And your skull is just beautifully balanced and supported. Heavy, heavy skull, heaviest bone in the body. Totally supported by this extraordinary spine and all the muscles and connective tissue surrounding it. You can maybe just send your chin very slightly upwards and downwards, and notice how if you send your chin up and down, it rocks your spine on the top of your cervical vertebrae. And taking a few breaths just to have a sense now of cervical vertebrae, your thoracic vertebrae, your lumbar vertebrae, and your sacrum. This extraordinary spine like a ladder that you could almost climb up and climb down again. And inside your spine, there are nerves. There's liquid flowing. There's so much extraordinary activity going on right now that we and not even aware of, allowing your body to be present. And then slowly coming back down through the cervical vertebrae, climbing down through the neck, through the throat, all of those muscles, coming back into your rib cage. And just while you're here in your rib cage, I'd like you to imagine that you have a torch shining out between your breasts. And just have a sense, where is that torch shining right now? Is it directly at 12 o'clock? Could it be slightly towards 11 o'clock or 1 o'clock? And just make sure it's shining directly towards 12 o'clock. And then coming down into your belly, through the lumbar vertebrae, and again in your belly button, imagine you have a torch. Is it shining directly at 12 o'clock, or is it a few minutes to 12 or after 12? Again, just checking what your tailbone is doing, the bone right at the base of your spine. Just sending it slightly under and then sending it backwards. And then feeling it, feeling into the femur bones in your thighs, coming down to where they connect into your knees, feeling into the tibia and fibula bones in your lower legs, feeling where they come down into your heels and your ankles, and then feeling into those 26 bones in your feet, giving them a good squeeze and then spreading, squeeze and then spreading them, and squeeze and then spreading. And then I'd like to invite you to open your eyes and just look at something right in front of you. Just see it, shapes it, what is it? And then looking towards your right hand side at 3 o'clock, just look at something in your room or outside your window, just seeing it, bringing you back into the here and now. And then again at 9 o'clock, just noticing what you have, what's around you right now in this world, here and now, in the external environment, because we've just been in your internal environment. And then just coming back into the moment, right back into being here on a Zoom screen with this lovely group that we have. And maybe you can just share a little bit. If anyone needs to go, I completely understand. I did want to do some introductions as we have new people. If anyone needs to leave, that's fine. Yeah, but would anyone like to share how that was for them?
I really enjoyed that, and I found it harder to visualize the spines and all the vertebrae, but when you came up to the rib cage, I could really see that clearly. Okay. I noticed the anterior tilt. Mm-hmm. I felt far more relaxed standing in that position. I could feel the difference.
Yeah.
And yeah, it's fascinating.
So could you feel the difference when you touch your tailbone under?
Yes.
And did that feel nicer?
Yes.
Or
yeah.
Your gait does not allow that to happen. Yeah. Every single footstep you take, you just, and that feeling nicer, that's what I mean. That's what I was mentioning. You know, it's a completely different. But we have to teach that to you. You can't force
awareness, it. Though you're not aware of it until, well, and I wasn't aware of it until.
I know. I know. I know. That's why I'm writing a book about it. I'm fully aware of the lack of knowledge.
So how many pages is it going to be?
What, the book? The proposal is just
2,000 pages.
I don't know, that we're trying to keep it very simple so a 10-year-old could understand it, to be honest. This is not about wowing people with science. This is about making what should be, you know, as simple so a child can learn it. That's my purpose here. It's not rocket science what I just did with you. Anyone can do it. Yeah. Okay, anyone else would like to? Rose, are you there? I can hardly see you, but I'd love to know how that was for you. Was it really confusing or was it okay? Shall I try and unmute you, or shall I ask you to unmute? There we go. There we go, Rose.
Well, it's all very, very new to me, so
Yeah.
I really don't know how to explain it, but
yeah,
I'm still very, very I won't say confused, but really don't understand it yet.
Yeah.
That's where I am. So I'm open to further consultation with you.
Sorry, I can't hear you very well, Rose.
Yeah, so I'm open to further consultation with you. I couldn't really
Yes.
move properly, and
Yeah.
because of pain and things that I'm going through. So I've had to be very careful, very, very small movements, so that I don't aggravate any
Absolutely.
more. So like I said, I appreciate more consultation with you.
Absolutely, we will arrange something, Rose. And I think that the thing to take from this process is that we live in a body, and simply coming in feeling confusing is, that's what we want to work with. We want you to feel at home in your body. We want you to have an understanding of what's going on and how to adjust things. That's what we're doing here. So yeah, we'll arrange something, Rose, of course. Melanie, how was that for you?
Hi, yeah, and it was great to just be able to slow it down and come back into the body. We're so used to sort of, doing our thing and forgetting actually until we get an ache and a pain, and then we're like, oh, what's that about? So really lovely to be able to slow that down and think about, well, what actually is my body doing here? Yeah, thank you.
I'd recommend you send me a gait video of how you walk, because people with a lot going on in their rib cage are usually rushing forward with their upper body. So you'll always be in a rush. It's really fascinating. So
that's my life generally.
I know. I mean, it is so predictable. I can't tell you. Whatever your pathology is, it already tells me a lot about your structure without even having seen your gait. Because when people are rushing, literally, if you think about the energy of rushing, which is cortisol, adrenaline, but also people are charging forward with their upper body, and it's just not supported, okay, by your foundation. And so personalities are very, very wrapped up in gait. Yeah, there's I work with physical pain, emotional pain, personality, alignment. We do not separate any of it out. It is all one and the same thing. Yeah, your structure is simply a product. Now, it could be you were born with that alignment. Sometimes it's that, but it's just reminding the body to move slightly differently. Yeah, which we can do. You'll be amazed. Send me I'll put a link in the group for the gait video to show how to do it.
Thank you.
Helly, how was that for you? Having only met me yesterday.
For me, it was not confusing, because I'm very used to feel my body.
Yeah.
And I was a little bit what do you call surprised when you said that was the way I was walking, and I can understand that now. But I'm very used to feel my body, the vertebrae and the sacrum and all that. But I think it's very nice to do it, to get into the body and feel it. But I do it every day, feel my body. So for me,
it's not unusual.
No, it's not unusual.
No. So this session this morning is for people who don't do that very often. And then the biomechanic realignment that we look at this evening is more kind of what your body is kind of needing.
Yeah, I know. Yeah.
So there is a session this evening at 8 p.m. UK, Denmark time.
Yeah.
Joe, how are you doing? You're on mute. Let's unmute you.
No, I really the thing I noticed the most was just everything just slowing down to almost to, well, somewhere that I don't go very often. You're talking about the rushing around.
Yeah.
So just, although I couldn't feel all of it, I could feel and engage with most of it.
Yeah.
And I could really feel the ribs when you were talking about the flashlight. It's not often that I think about my ribs. So I did. So those were the main things. But I just felt very calm and slow, which is a real positive, I'd say.
Yeah. And for you know, when we come into the biomechanic alignment, the brain needs some calmness and some slowness to integrate the new movement. So that's, you know, very often I take people through the biomechanics and they don't do this bit. So it makes it trickier for them to integrate it. So this bit's important, although it's not like the book. This isn't in the book. What we're doing today, it's just not relevant to the realignment. But this is, from a personal perspective, very important to remember to do. Yeah. Diana, how are you doing?
Yeah, it was good. I got distracted a few times, but it didn't really prevent me from like connecting. But I think for me it was more developing that awareness of, you know, the sensation in the spine that I don't think I have. So yeah.
I think when we are in when we're having to mobilize all the time, we're in fight or flight and we need to mobilize. The very nature of that is about moving us around. It's counterintuitive. It's not, the spine isn't designed to be still when it's moving. It's got chemicals going through it to make us kind of do stuff rather than be still. So it's an interesting experiment to practice feeling into the spine when its very design is to make us react and respond rather than be still. So it's quite an interesting thing from that perspective, you know, but it's good to get a handle on it. It's a bit like, is it a horse that's galloping away, or can we get some reins on it and rein it in a bit? Yeah, of course, Kate. Okay. Malasula, how are you doing?
Hi, I just noticing, you know, when I have a bit of pain, foot pain, how much it impacts. And this is on the scale of 1 to 10, you know, it's probably about a 4, but how much it impacts my exhaustion, you know, feeling exhausted. And just standing there, and I've been doing body work for like over 40 years, feeling in. However, every single time I do it, it almost feels like, you know, it can feel like the first time sometimes in noticing the spine, and then you notice a little bit more. And I tend to do it with also just feeling it with the outside, so it helps me to locate it. And it's quite, it was very, I could feel that much more of my actual spine today.
Good.
And just very, very, because I tended to do much larger movements when I first came to you. I was much more kind of doing, and now it's very tiny movements, and it's quite exhausting. I find it quite exhausting
Because they are so deep and teeny, yet those are the core movements.
But it was very good. Thank you.
All right, that's great. So we have our shoulder session this evening, which is a drop-in for people. So you're welcome to come to that. That's at 7 o'clock UK time. Helly, do you have a moment to speak now? We can have a chat. Yeah. Rose, we can arrange to arrange a time to speak, to have a proper conversation. I'm going to send you a link, and I would really appreciate you do a slow-mo video of yourself walking before we have our conversation. Okay, so then we will look at that together and I'll explain what's happening. All right.
Right. Thank you.
All right, everyone. I will see you, and Ellie will have a chat now. Okay.
Bye-bye.
Yes.
Thank you for being here,
you.
and let me stop the stream.